What is the recommended compression depth for adult CPR? A. About 1 inch. B. About 2 inches. C. At least 3 inches. D. Less than 1.5 inches. Answer, B. Adult chest compression should be at least 2 inches deep to create enough pressure for effective blood circulation, but not more than 2.4 inches to avoid injury. What is the correct compression to ventilation ratio for single rescuer adult CPR? A. 15:2. B. 30:2. C. 20:2. D. 5:1. Answer, B. A 30:2 ratio is recommended for a single rescuer, ensuring sufficient circulation and oxygen delivery. Which pulse should be checked in an adult during BLS? A. Brachial. B. Femoral. C. Radial. D. Carotid. Answer, D. The carotid pulse is easiest to locate and most reliable during adult resuscitation efforts. When should rescuers switch compressors during CPR? A. Every 5 minutes. B. Every 2 minutes. C. Every 1 minute. D. After 10 cycles. Answer, B. Rescuers should switch every 2 minutes to prevent fatigue and maintain high-quality compressions. What is the compression rate for adult CPR? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer, C. 100 to 120 compressions per minute optimize perfusion while preventing shallow or ineffective compressions. Which action should be taken first if an adult collapses and is unresponsive? A. Begin chest compressions. B. Check breathing and pulse. C. Call emergency services and get an AED. D. Give 2 rescue breaths. Answer, C. Immediate activation of EMS and retrieval of an AED ensures timely professional help while CPR is initiated. In BLS, what should be done if the victim is breathing normally but unresponsive? A. Begin compressions. B. Place them in recovery position. C. Give rescue breaths. D. Start defibrillation. Answer, B. A victim with normal breathing but unresponsive should be placed in the recovery position to maintain airway patency and prevent aspiration. During to rescuer infant CPR, what is the correct compression to ventilation ratio? A. 15:2. B. 30:2. C. 20:2. D. 10:1. Answer, A. For infants with 2 rescuers, the ratio changes to 15:2 to provide more ventilation relative to compressions. Which pulse is assessed in infants for BLS? A. Radial. B. Carotid. C. Femoral. D. Brachial. Answer, D. The brachial pulse is easiest and most accurate to check in infants due to vessel size and accessibility. When performing CPR on a child, the depth of compression should be A. About 1 inch. B. About 2 inches or 1/3 of the chest depth. C. At least 3 inches. D. Less than 1.5 inches. Answer, B. Child compression should be about 2 inches deep or 1/3 the anterior-posterior chest diameter to generate adequate circulation. What is the preferred technique for infant chest compressions when 2 rescuers are present? A. 2-thumb encircling hands technique. B. 2-finger technique. C. 1-hand technique. D. Heel of hand. Answer, A. The 2-thumb encircling technique provides better compression depth and consistency when 2 rescuers are available. What is the first step after turning on an AED? A. Deliver a shock immediately. B. Place the pads on the victim's chest. C. Analyze the rhythm. D. Follow the voice prompts. Answer, D. AEDs are designed to guide rescuers with voice prompts, ensuring correct step-by-step actions. If an AED advises no shock, what should rescuers do next? A. Stop CPR and wait. B. Check the pads again. C. Resume chest compressions immediately. D. Deliver a manual shock. Answer, C. When no shock is advised, chest compressions must continue to maintain blood circulation. What is the correct hand placement for adult CPR? A. One hand on the lower sternum. B. Two hands on the lower half of the sternum. C. Over the xiphoid process. D. On the left side of the chest. Answer, B. Hands should be placed on the lower half of the sternum, avoiding the xiphoid process to prevent injury. Which of the following is a sign of effective chest compressions? A. Chest rises with each compression. B. Victim gasps for air. C. Chest recoil occurs after each compression. D. Audible clicking noise. Answer, C. Full chest recoil ensures blood refilling of the heart, which is critical for circulation. What is the maximum time rescuers should take to check for a pulse? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Answer, B. Pulse checks should not exceed 10 seconds to avoid delays in CPR initiation. In a choking infant, what is the correct sequence of interventions? A. 5 back blows followed by 5 chest thrusts. B. 30 compressions followed by 2 breaths. C. Heimlich maneuver. D. Direct suctioning only. Answer, A. For infants, alternating 5 back blows and 5 chest thrusts clears airway obstruction effectively. What is the recommended rate of rescue breaths when an advanced airway is in place during CPR? A. 1 breath every 3 seconds. B. 1 breath every 5 to 6 seconds. C. 1 breath every 6 seconds. D. Continuous breaths with compressions. Answer, C. With an advanced airway, breaths are delivered every 6 seconds while compressions continue uninterrupted. Which is a common mistake during BLS that reduces effectiveness? A. Allowing full chest recoil. B. Switching rescuers every 2 minutes. C. Leaning on the chest during compressions. D. Using a compression rate of 100 to 120. Answer, C. Leaning on the chest prevents full recoil, which limits blood refilling and reduces perfusion. In a drowning victim, what is the first priority in BLS? A. Starting compressions. B. Providing 2 initial rescue breaths. C. Activating EMS. D. Using an AED. Answer, B. For drowning victims, oxygen delivery is critical, so 2 rescue breaths should be given before compressions. What is the best way to minimize interruptions in compressions when using an AED? A. Pause frequently to check rhythm. B. Resume compressions immediately after shock or no shock message. C. Wait until AED finishes its entire cycle. D. Give 2 breaths before resuming compressions. Answer, B. High-quality CPR requires minimal pauses, resuming compressions right after AED prompts. In which situation should a pulse check be omitted? A. In a child who is breathing but unresponsive. B. In an adult with gasping breaths only. C. In any victim with no signs of life. D. In an infant showing weak movements. Answer, B. Agonal gasps are not normal breathing. CPR should begin immediately without delaying for a pulse check. During BLS for a pregnant woman, what modification should be made? A. Tilt the patient's torso to the left. B. Perform compressions on the upper chest. C. Delay AED use until delivery. D. Use only rescue breaths. Answer, A. Tilting to the left relieves pressure on the vena cava, improving blood flow during compressions. If a child victim has a pulse but is not breathing adequately, how should rescue breaths be delivered? A. 1 breath every 6 seconds. B. 1 breath every 3 to 5 seconds. C. 2 breaths every 30 seconds. D. Continuous breaths with compressions. Answer, B. For children with a pulse, rescue breaths should be given every 3 to 5 seconds to maintain oxygenation. What should a rescuer do if they are alone and witness a child collapse? A. Start CPR immediately and delay calling EMS. B. Call EMS and get an AED before starting CPR. C. Deliver 2 minutes of CPR, then activate EMS. D. Perform only rescue breaths until help arrives. Answer: B. If the collapse is witnessed, EMS activation and AED retrieval come first to ensure timely advanced care.